are cultural factors considered in the differential diagnosis process? How do cultural factors come into play during the differential diagnosis process for autism spectrum disorder? This is an important question that can help us understand how to better support individuals and families. Cultural factors significantly influence how symptoms are recognized, interpreted, and reported by families and clinicians. Recognizing these influences is essential to avoid misdiagnosis or delays, especially in diverse populations. First, culture shapes perceptions of what behaviors are typical or atypical. For instance, behaviors like limited eye contact or a strong preference for routine may be seen differently across cultures. In some cultures, avoiding eye contact is a sign of respect rather than a social challenge. This can complicate the identification of autism-related social communication issues. Similarly, expressiveness or spontaneity may be valued differently, affecting how symptoms are perceived by caregivers and professionals. Second, cultural beliefs and stigma surrounding disabilities can impact whether families seek evaluation or express concerns. In certain communities, autism may be misunderstood or linked to shame or supernatural causes. This can discourage families from pursuing a diagnosis or intervention, leading to delays in recognizing early signs and accessing necessary services. Third, language and cultural norms play a role in caregiver reports during assessments. Families from culturally diverse backgrounds may interpret or describe behaviors based on their cultural context. This can affect the clinical picture presented to multidisciplinary assessment teams. Clinicians need to be culturally sensitive and use assessment tools that are validated for different cultural groups when possible. Fourth, systemic factors at the societal or healthcare level, such as the availability of culturally appropriate diagnostic tools and trust in healthcare systems, also impact the differential diagnosis process. A lack of culturally tailored screening or intervention services can lead to underdiagnosis or misdiagnosis in minority or immigrant populations. In practical terms, multidisciplinary teams conducting differential diagnosis for autism spectrum disorder should take detailed cultural histories. This helps to understand family beliefs, values, and norms related to child development and behavior. They should use culturally sensitive communication and consider cultural explanations for behaviors while evaluating core autism symptoms. It is also important for these teams to be aware of cultural variations in symptom presentation and caregiver reporting. They should adjust how they apply diagnostic criteria accordingly. Employing or adapting diagnostic instruments that account for cultural differences can improve accuracy. Addressing potential stigma and building trust with families encourages open discussions about concerns. Collaborating with cultural mediators or interpreters is essential when language barriers exist. Considering cultural factors helps differentiate autism from other developmental or behavioral conditions that might be interpreted differently in various cultural contexts. This approach supports earlier and more accurate diagnosis, enabling timely intervention tailored to the child's and family's cultural background. Integrating cultural understanding into clinical decision-making ultimately improves outcomes for autistic individuals across diverse populations.